Dr. Babar, thank you so much for joining us today. I want to talk first about the numbers because there is some concern that they are starting to tick upward a little bit as far as the weekly averages, and there are a lot of concerns out there about that. What are you seeing at the hospital as well?
Yeah, we've seen an uptick in numbers, Karen, the number of positives, and then kind of the number of people in the ICU kind of follows that trend also. So yeah, we have a fairly stable number in the ICU as well.
Dr. Dobbs, the state health officer, actually tweeted yesterday and said our equilibrium is unraveling, something along those lines. And I think he was going back in part to the lifting of the mask mandate as being the beginning of that. And then, of course, now here on the coast, we have Cruising the Coast. In Jackson, they have the big state fair going on. These types of large gatherings can't help either. What are your concerns right now about the numbers that are ticking upward?
I think it's all of these things. I also think and I've said this before, it's the schools. Our teenagers going into schools and then, I mean, other activities, these cause transmission. And, this is a disease that is not always going to produce symptoms. So unfortunately, that's how it's transmitted. All these gatherings add to it, all these other gatherings that we have right now.
Sure. And I'm curious because we've been hearing so much about the president's fight with COVID-19 and his treatment regimen. And he is still taking the steroid dexamethasone, which, from what I understand, is normally reserved for people with the potential for lung issues, and that is your area of expertise. What are your thoughts on him continuing to take that steroid? Is that, do you think, precaution? I mean, I know you can't speak about the president per se, but is this unusual for someone in his, seems to be in pretty good condition, considering he has COVID? Is it unusual for him to be taking this steroid?
Once we start it, we usually complete a 10-day course. And the reason is that the study that was performed used it that way. So if we initiate it, which is in anybody who has any drop in oxygen level, then we will usually complete the 10-day course. So it's not unusual to be continuing and completing this course.
All right. Well, that's good to know. And just as we wrap this up today, what's your message to people out there as they are out and about? And
don't let down. Don't let down. And I keep talking to family members of patients we have in the ICU. And I keep telling them this is a terrible disease. Yes, 90% of people will be okay, but the 10% who aren't, it's just not a good place to be in.
All right, Dr. Ijlal Babar, pulmonologist at Singing River. Thank you so much for joining us today.
Thank you for having me.